into one word, what would that word be?
I think I would say nursing is diverse because you can, go into a hospital setting or non-hospital setting, and within the hospital you can try out different floors, whether, it's cardiac to pediatrics to NICU. So I think just, you can always try different things and move through the profession in different ways.
Okay. Tell us how an interaction with a nurse has made a difference in your life.
I would say most recently is when I was pregnant with my son and had to go in for an emergency C-section and ended up having to spend a whole week at the hospital, which we thought was only going to be, 2 to 3 days, and just having the nurses there by the bedside and helping you through difficult situations really shows the impact a nurse can have on, a patient, just being there for them emotionally and physically.
How has being a nurse yourself had an effect on your ability to start and raise a family?
Well, speaking of when I had my son, I was working full-time and I was able to cut back to PRN, which means I just had to work a few weekend shifts a month and then could pick up shifts here and there whenever I wanted. So I think it's worked out great just because, I can pick up as few shifts as I want, or there's oftentimes just 2 shortages on the floor or hospital-wide where I could call, 24 to 48 hours in advance and pick up some more shifts. So I think it's, great just being able to raise a family and pick your days throughout the week.
Do you have any recommendations for future nurses?
I think my recommendation for future nurses is to continue your education and try to do it from the beginning. I kind of started where I got my bachelor's in nutrition and then went back to nursing school, which at the time was a diploma program. And then now, once I started as a nurse, I'm back in school online getting my bachelor's. And so I just think once you have a family, it can be difficult to manage school and work. So I would do it all at once.
Okay, perfect. Thanks.